What if one supplement could make your entire immune system smarter? Not stronger, in an aggressive way, smarter. That's exactly what BWH 85 beta-glucan from BWH Labs does. It works with your immune system, helping it recognize threats, respond effectively, and protect you the way nature intended. BWH Labs has spent over 25 years perfecting the purest, most biologically active beta-glucan on the market, an 85% pure formula that's been tested against 200 competitors and named the most effective immune modulator in peer-reviewed research. The science speaks for itself, just one ingredient, one focus. Unmatched results. Doctors and integrative health practitioners trust BWH 85 beta-glucan, and so do I. It's available in 100 milligrams for daily support or 500 milligrams for maximum immune defense. It's only available through health practitioners, but as an intelligent medicine listener, it's available to you through my full script dispensary. Just go to drhoffman.com/BWH for more information and to order. That's drhoffman.com/BWH. Because a smarter immune system starts with one smart choice. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. We're talking about the new statement by the American Heart Association. They've done kind of a 180 on coffee, formerly vilified as a culprit in heart problems. Now, they have made a kind of a qualified statement about coffee maybe being okay, maybe even being beneficial for the heart in certain circumstances. Clarifying that for us is the chair of the Scientific Statement Writing Group. He possibly had a hand, I guess, in crafting the statement by the American Heart Association, Dr. Gregory Marcus. He is an electrophysiologist. That is a subspecialty within cardiology, dealing with cardiac arrhythmias and testing people for cardiac ablation. We'll talk a little bit about that in this segment. So, Dr. Marcus, you were leading up to a discussion about another type of heart problem, which is a pervasive problem. It's heart failure. And from what I understand is that we are kind of, to some extent, winning the battle against heart attacks. To some extent, because less people are smoking. We've introduced statin drugs. They're widely deployed, and we have better techniques to help people survive heart attacks. We get them in real fast, and we revascularize them, and so heart attacks are less of a problem. But as people get older, and perhaps they've had some heart damage, we still haven't turned the corner on congestive heart failure. And so let's talk about that.
Yes, indeed. So I think that so cardiovascular disease is the number one killer in the world, in the U.S., even among women. I think there's this idea that it's breast cancer, but even in women, heart disease is the number one killer. It used to be that was all due to heart attack, the blockages of the blood vessels supplying blood to the heart. As you mentioned, that has been a success story, where the risks of heart attack are much, much lower than they used to be. So if you now look at, well, what is responsible for what are the most rapidly growing causes of heart disease related death? Those are arrhythmias. So we talked about atrial fibrillation, abnormal heart rhythm, and heart failure. This, which really has two forms, broadly speaking, a weakening of the heart versus a problem with filling of the heart. The commonality there being it's an issue with the pumping function of the heart. And here, the relationships with caffeine, caffeinated coffee are not as straightforward as they are in some of the others. Here also that we do not have the benefit of randomized trials, so we need to rely on the observational studies that have the limitations we talked about. They could be confounded despite the best attempts to try to do statistical adjustment for that confounding. But the evidence currently suggests that people who consume caffeine, predominantly caffeinated coffee, at a low level may be protected against heart failure. But once you get up to about 4 or 5 drinks per day, the risk of heart failure does seem to go up.
Okay. So there's sort of like a sweet spot or a Goldilocks effect.
Yes. And it's possible, I mentioned earlier how it seems that caffeine may increase the risk for these PVCs, these premature ventricular contractions. We now know that people with more of those PVCs might be at higher risk for heart failure. So that's one potential mechanism. But yes, if there's a concern about heart failure, generally for my patients at least, I don't necessarily recommend avoiding caffeinated coffee, but certainly would try to limit it to probably not more than 2 or 3 cups per day.
Okay. So coffee and tea are not the only ways that people consume caffeine in this country. And there's been enormous popularization of energy drinks, Monster Beverage and Red Bull. And now there are all kinds of iterations of these energy drinks that actually deliver more caffeine than, a double shot of Starbucks coffee, but not with the accompanying beneficial compounds in coffee. Sometimes with some B vitamins, a smattering of, maybe some amino acids, and other flavoring ingredients. So, does the benefit carry over to those as well or not?
Yeah, it's a very important question. So the benefits that have been observed, or possible benefits with caffeinated coffee, decaffeinated coffee, caffeinated tea, should not be extrapolated to these energy drinks. The energy drinks have not been as extensively studied, probably because they haven't been around as long. But what little data is available actually would suggest harm to the cardiovascular system. So there are many reports.
Highly publicized reports. I mean, you may not be seeing these things, but you're probably, your ears perk up when you see a lurid account of some kid who goes on a energy drink jag and dies. Can happen.
Right. Yeah. So we know that very high dose caffeine, like in pure form, clearly can lead to literally lethal arrhythmias, such as ventricular fibrillation. I don't want to suggest that energy drinks have that much caffeine in them, but this gets back to the individual propensities. So there are these very tragic cases of young, otherwise healthy individuals dying suddenly after consuming high caffeine concentration drinks. Probably those individuals did have some propensity, presumably inherited, towards that. I suspect in many cases, if you investigated carefully, you would find there was a family history of sudden death. And maybe as a bit of a public service announcement here, as an electrophysiologist, I should say, if you have someone, a first-degree family member in particular, that died suddenly or died at an early age or tends to pass out, you should talk to your doctor about that, and certainly would avoid any of these energy drinks.
And does this extend, this is the season where a lot of, high school and college teams ramp up and they, do boot camp in the heat. And tragically, it's reliably every summer you read about a tragic incident of a young person who dies, experiences sudden death. And then they do a postmortem and they say, oh, they had this rare cardiac anomaly, and they probably should have gotten a stress test or an echocardiogram or some evaluation prior to intense exertion.
Yeah. Yes. So, this is a tangent, but I think we both would agree this is an important point of discussion. So yes, again, should talk to your physician about that, let them know. And I would emphasize, I mentioned sudden death or early death. There's no clear cutoff what constitutes an early death. Let's say, to be conservative, younger than age 60. The reason I mention that is, we'll see some patient who, for example, was resuscitated with CPR, with a shock. They essentially died and were brought back. We're trying to figure out what the reason was. And I asked them, anyone in the family that, died, just collapsed and died? No. Okay. Anyone in the family that died at an early age? Oh yeah, my sister was driving. She drove off a cliff. We don't know why. So you have to be suspicious. And then sometimes people are told, oh, your father died of a heart attack. Yeah. And sometimes that's actually sudden death. It wasn't truly an occlusion to an artery that led to a heart attack.
So let's distinguish, if you drop dead, it could be because you had a blood clot in a main artery and game over. But it's also possible that you had clean arteries and you had an arrhythmia. And, we see this on these doctor shows all the time. They bring people in and they got that zigzag pattern, and then they applied, the electrical, electroshock, clear.
Yeah.
And then it's like they normalize the rhythm. You've probably done it a million times. This is another cause of sudden death rather than
Correct.
a blood clot. Okay.
That's right. And it unfortunately can strike otherwise healthy appearing individuals, athletic individuals in the middle of sports, drinking energy drinks. Another little caveat off of this is because it got a lot of publicity. Your listeners may remember the NFL.
Yeah, I was going to say the guy. Yeah, the
collapsed.
Buffalo.
Yeah, so that was different. So it was the same but different. Meaning, so there is this phenomenon.
Cardio, something or other.
Commotio cordis.
Okay.
So so this is not inherited.
Yeah.
And interestingly, is not a sign of a future risk of sudden death.
Right.
It's just striking the chest in just the right way or the wrong way, depending on how you see it, at just the right or wrong time during the electrical cycle can induce ventricular fibrillation.
Right. Yeah, like a fastball, to the breastbone, or like a hard hit,
exactly
on the field.
Exactly.
Yeah.
So incidentally, if you are ever watching an athletic game and the kid gets hit by a softball or something, or a baseball in their chest, and they suddenly collapse, call 911
immediately.
They need to be shocked out of a potentially.
And I think there's a greater awareness that there should be defibrillators present at events. If not for the players, statistically, you put a lot of spectators into a place and somebody's going to have a problem potentially. Okay. So, all right. So these energy drinks, maybe not such a good idea. We should place limits on the amount.
And I should say that even in people who don't have a family history, people aren't dying suddenly per se, but there are a number of cases of atrial fibrillation, for example, in people in their 20s after drinking these energy drinks, and heart failure as well.
Wow.
As you mentioned, the additives in there may also have harmful effects. And because the caffeine is so concentrated, one of the things with caffeinated coffee, caffeinated tea is that the caffeine is not so concentrated that we can self-titrate. We can start to feel after a cup of coffee, oh, you know what? I'm feeling a little anxious, a little jittery. I'm not going to have any more.
And you don't generally chug a hot cup of coffee. That's another, the way you consume it is that you might gradually deliver the caffeine to your system. And, a cold drink and, you're thirsty, boom.
Yes. And these can have twice as much caffeine, if not more, than a typical caffeinated coffee drink. So by the time, it may be too late when you're done drinking it, then you're overwhelmed by the discomfort, the uncomfortable caffeinated effects.
Is the American Heart Association worried about other non-cardiac effects of coffee, such as sleep disturbances, such as mood disturbances, anxiety? Or is that off the table for an organization that focuses on the heart?
Yeah, so this was really, as a scientific statement, was meant to be a review of the evidence. And it was focused on cardiovascular disease and also, incidentally, pointing out where we need more research, and clearly we do. And I should also mention that the great majority of this research is taxpayer funded. This is an example of federally funded research, investigator initiated, curiosity driven.
It's public interest.
Biased.
Right.
Yeah.
And incidentally, not funded by the, the American Coffee Growers Association or, something, Juan Valdez in Colombia, the fix is on kind of thing.
Yeah. So there, hopefully folks recognize there's tremendous value here to understanding these effects on our health. Remind me what was your last question? I was going to make a.
Oh, no, you answered it. I think, so I wanted to talk a little bit about, do we vitiate the benefits of coffee, or do we know this by putting in milk and sugar? Because, for a lot of people, I think the American Heart Association is taking a more aggressive stance against refined carbohydrates. And one of the ways that people get a lot of refined carbohydrates is not just through coffee, but, the coffee drinks, like you go to Starbucks and you get it's almost like you're having dessert for breakfast.
Yeah, the honest answer is we don't know for sure
Okay.
whether or to what degree these additives might reduce the potential benefits. But we know separately that refined sugars are almost certainly not healthy, can lead to obesity, diabetes, which themselves can lead to heart attack, heart failure, stroke, all atrial fibrillation. The creamers are a little bit more tricky and more probably not so straightforward. We don't know. It could be that even whole milk, that cream may not necessarily be harmful. That's an active area
Right.
of
Yeah,
research.
they're sort of changing their stance on high-fat dairy. But I'm thinking of, does it bind the polyphenols to, kind of take away the benefits? Should one drink your coffee black? In other words,
Yeah, so the data, the observational data that comes from very large numbers of people consuming coffee, they tended to be doing so the way that they like to consume it. So
however,
almost certainly these studies we reviewed included people consuming
mixed.
coffee with some cream in it. Yeah.
Hmm. Can we switch gears and talk about, other things that may affect the heart? Alcohol. And, I used to, my training was at the VA hospital here in Manhattan, and I had the misfortune often to be on duty during a holiday, during Memorial Day, Labor Day, 4th of July. And we used to refer to those assignments as it's holiday heart time. And we
Mhm.
would get a tremendous influx of older vets coming in with heart problems, cardiac arrhythmias. They would go into atrial fibrillation. And why?
Mhm.
Well, they did a little too much tippling. That's a known effect, right?
Yes, and actually my group has done quite a bit of research on this. We've even had people wearing alcohol sensors while wearing an
Like
EKG
like
and
a
showed
breathalyzer kind of thing or something.
around their ankle.
Oh,
Uh, yeah, and
okay.
and showed that yes, there is a relationship in a short period of time between excess alcohol and AFib. There's even been a randomized trial now to show among heavy drinkers, if they reduce their alcohol consumption, they can reduce their atrial fibrillation. So there's clearly a causal relationship. But importantly, and this is also an active area of research, and there was also an American Heart Association scientific statement on this as well recently on alcohol and heart disease. We still don't fully know what the true effects of consuming alcohol in moderation are on the heart. And that
Moderation. Hmm.
meaning just a drink a day, like a
Hmm.
glass of red wine with dinner.
Hmm.
There are some entities that come down hard and say there's no healthy amount of alcohol, but
That would
uh,
be the oncologists because there's pretty clearly established
well,
cancer linked to moderate, even relatively moderate consumption of alcohol.
yes. So recognizing I'm waiting a little bit outside my area of expertise as a cardiologist, but I have done quite a bit of research on alcohol. So there is quite consistent evidence that even moderate alcohol, even a drink a day, may increase the risk for breast cancer.
Hmm.
Again, this is all observational. That seems fairly clear. But there's also evidence that moderate alcohol may reduce the risk for lymphoma
Oh,
and for kidney cancer.
okay.
So it's not as clear cut.
Yeah.
And again, just to be very clear, excess alcohol is harmful. Even when it comes to heart attack, there's more heart attacks among
Yeah.
people who consume
Yeah.
excess alcohol. Almost any adverse outcome you want to look at, various cancers, various forms of heart disease, high blood pressure, all higher risk with excess. So
Stroke. Yeah.
really
Yeah.
the open question, and it's important that we not be too dogmatic or ideologic here, because we need research, and you can't do the research if people prematurely make too firm a conclusion. And so this question of just a drink a day, what the true effects are on that's an active area of
Hmm.
research.
Yeah.
Now, some people will say, but I can't have, what's the point of having just one drink of alcohol? And my answer to that is, well, if that's how you view alcohol, you should
Right.
not drink any alcohol.
Right.
We're just talking about the people that really do enjoy one glass
Right.
of red wine with dinner, ideally, and not more than that.
Indeed. Uh, and that whole connection with resveratrol, that was a little bit
Mm.
overblown because you'd have to consume massive amounts of wine to get the requisite amount of resveratrol that's heart protective. So that French paradox thing kind of is a little passé. Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you. So Here we go. Please listen up.
Kids don't just bring home homework, they bring home germs. And those germs don't just stay with them, they spread to the whole household. That's why Clear Nasal Spray was created by a practicing physician to give parents and grandparents peace of mind. You may not think about it, but your nose is filtering out a semi-truck full of air every single day. Clear isn't just another spray. It creates an additional layer of protection in your nose that blocks bacteria and viruses before they can even take hold. Yes, even that virus. Supporting your body's defenses right where germs first try to enter. Clear is a hygiene product recommended for daily use, drug-free, non-drowsy, and safe for all ages. Just a quick spray in the morning and evening helps you cleanse your nose. Don't just hope for protection, create it. Get Clear Nasal Spray, your daily defense. Clear Nasal Spray is available at retailers nationwide and online. Check out Xlear.com for our special offers. That's Xlear.com.
Thanks for listening. Thanks for supporting our sponsors. And now back to today's guest, Dr. Gregory Marcus. What about marijuana or THC? Has that been studied?
Well, funny that you ask, because there's a paper that just came out today, literally a randomized trial that we actually conducted with the limitation of it being among regular cannabis inhalers, users, so those who smoked or vaped, not with heart rhythm disorders, but we put an EKG monitor on them.
Oh.
Contrary to what we thought we would find, we saw less early heartbeats on days randomly assigned to inhaled cannabis.
Okay.
Lots of potential limitations there. There is evidence that the smoke from cannabis may be harmful, especially to blood pressure and to the heart in general, may increase the risk for arrhythmias, but definitely an area that deserves more research.
Burnt plant material that, tiny particles that can, enter the lungs and enter the circulatory system potentially, could be atherogenic or, deleterious. So those require longer term studies. Okay, so I know there is no specific diet that you counsel patients with atrial fibrillation to follow, but I think there's some preliminary evidence that if you follow a clean Mediterranean diet, you might have a lower propensity to getting it in the first place. And is there evidence for that?
Yeah, so there's at least one trial. Well, it was a secondary analysis of the famous trial on the Mediterranean diet that showed benefit. Interestingly, going back to this question of alcohol, the Mediterranean diet allows for a glass of red wine with dinner. And that diet has probably the strongest evidence in favor of cardiovascular benefit. There's another one called the DASH diet, which is a little harder to adhere to, tends to be quite low in salt, that seems to be especially good for blood pressure, meaning to avoid high blood pressure. And I would imagine just knowing those mechanisms, that would probably reduce the risk for atrial fibrillation. We also know that obesity is clearly a risk factor for atrial fibrillation. And if people who are obese and lose weight, they actually do experience a lower risk for atrial fibrillation.
Indeed. And finally, I think there is actually some emerging evidence that air pollution might actually have a direct effect on the heart. And then there's some, correlational evidence or observational evidence that on, bad smog days, more people check in with heart problems. So anything to that?
Yeah, I think that this is unfortunately sometimes lost, as things get political and people talk about global warming, they ignore the effects of particulate matter pollution having this very clear relationship.
Which is the old-fashioned environmentalism. Yeah.
Yeah, higher risk of heart attack. We did a study where we took advantage of the fact that particulate matter went way down during the shutdown, during the pandemic, and showed much less heart attacks that correlated precisely with the particulate matter in the environment. Other investigators have used pacemaker data where you have continuous measurements of arrhythmias and showed in the same place, the same people, when the pollution went up, the arrhythmias went up. And when the pollution went down, the arrhythmias went down. So yes, it's a really important risk factor for heart disease, which again is the number one killer in the world.
And finally, you wanted to ask a little bit about what you do. From what I understand, I think there's some newfangled, less invasive types of pacemakers that are coming into use. Is that correct?
There's all kinds of newfangled things going on in the field of heart rhythm disorders, and there are at least two big ones. So there are what we call leadless pacemakers. So traditionally, we put pacemakers in through a vein, usually in the chest, that you put a wire down into the heart. You connect it up to a computerized generator that you put under the skin. Easy enough to put in and pretty low risk, but these leadless devices are little bullets, essentially bullet-sized devices that you implant in the heart without wires, and they can deliver energy, they can sense electrical activity and pace the heart. And then we also have new technologies that we're using for our catheter ablations to address fast rhythms such as atrial fibrillation that have made especially atrial fibrillation ablation procedures easier, safer, faster. And so they're becoming extraordinarily common procedures.
So explain to me, like I'm in sixth grade, why zapping the heart and knocking out part of the electrical system can actually help the heart rhythm normalize. Because that's what ablation is. You're actually zapping one of those electric pathways that travel through the heart.
Indeed. Where, to make it even more direct or blunt, we are deliberately killing some very carefully selected heart muscle cells that conduct electricity. So one clear example of this is one fast rhythm arises because people have an extra pathway that conducts their upper and lower chamber. So in that case, we map precisely where that pathway is, buzz it. These days, usually we will burn it with radio frequency energy and get rid of it. And we can do that in a way that does not adversely affect the pumping of the heart. For atrial fibrillation, we now recognize that the majority of atrial fibrillation arises from and probably relies on for perpetuation these veins that enter the left upper chamber called pulmonary veins that have sleeves of electrically conducting muscle in them. And we now know if we can isolate those electrically, so we kill those electrically conducting cells, we can render most people, unfortunately not 100%, but most people free of their atrial fibrillation. And the good news is that, again, those cells, that part of the left atrium is not necessary, does not contribute to pumping of the heart. If anything, the data suggests that after these ablations, the function of the heart actually improves, certainly compared to those patients being in atrial fibrillation.
And this is not for everyone, though, because some people don't require that intervention. They can control their atrial fibrillation through other means.
Yes, this is true, but this is also something in evolution. So 10, 20 years ago, the data suggested that whether you allow someone to remain in atrial fibrillation and then just give them a blood thinner to prevent the stroke.
Have to take the blood thinner. There's no way around it.
Have to take the blood thinner, assuming you have, yes, generally yes. There are some patients with atrial fibrillation without any other stroke risk factors that are very healthy, have a low burden. They may not need to, but most people generally need to take the blood thinner. Prior evidence suggested there was no clear benefit of trying to suppress the atrial fibrillation. And so we would reserve that mainly for people who really felt the atrial fibrillation, were very symptomatic.
Yeah, it was a kind of last resort. Right.
Yes. More recent evidence suggests that for most people with atrial fibrillation, especially if it's been recently diagnosed, such as in the last year, if you pursue what we call a normal sinus rhythm strategy, you try to prevent the AFib, you suppress it with either medicines or ablation, those patients actually do better. So we now recognize even if someone is asymptomatic in their atrial fibrillation, they may be at heightened risk for stroke. We also have some very early evidence that if we successfully ablate atrial fibrillation, in some patients, we can actually stop the blood thinner over the long term.
Oh, okay. That's a
the
really
field is rapidly
good
evolving.
prospect. Yeah, that's a great prospect, and it's certainly a plus. And finally, are you getting a tremendous influx of patients because more and more people have wearables and they're getting signals and maybe sometimes
Yes.
false alarms from their Apple Watches or various devices that they've got sometimes a potential arrhythmia.
Yes, indeed. So it's kind of a two-edged sword. So on the one hand, we recognize that atrial fibrillation can be asymptomatic and
Can be
cause
silent.
stroke.
Yep.
Yeah. And so those people who don't know they have AFib that may be alerted by a smartwatch would clearly benefit from getting anticoagulated, maybe getting ablated. On the other hand, those watches, those devices are not perfect, and they often can lead to false positives, especially in young, healthy people, which can lead to unnecessary anxiety, unnecessary testing. So this is another area where we really need to figure out as a medical community, as investigators, as clinicians, how do we help guide the public to optimize the use of those wearables?
Okay. Well, this has been a great, thoughtful and nuanced discussion. But I think finally, we don't want to leave people with the impression that, go on caffeinated coffee. Are there some specific exceptions? Are there some settings where you might say, hey, generally it's okay, but for you,
Yes.
yeah.
Yeah. So generally what I would take away from this scientific statement, the available evidence is, if people are currently enjoying consuming caffeinated coffee, caffeinated tea, decaffeinated coffee, they should be reassured that it's okay to do so. This is assuming their doctor has not told them to stop. And it's probably fine. It may be protective.
Mm-hmm.
If, however, you do not tolerate caffeine, you're uncomfortable with caffeine, there's no reason to start consuming
Right,
it.
exactly. Because you heard from the American Heart Association that it's good. It's like cultivate a caffeine habit. No. Right.
There's no evidence that one should increase their caffeine consumption based on this. There's no evidence one should initiate caffeine consumption because of this. And then if you have difficulty sleeping, then that, and sleep is obviously, or lack of sleep can be an important risk factor for various forms of heart disease as well as other problems. And caffeine clearly can interfere with sleep. In the CRAVE trial we talked about, there was less sleep on days where people were randomly assumed to caffeinated coffee. But interestingly, that depended on their genetics.
Mm-hmm.
So those who were slow caffeine metabolizers had almost an hour less sleep. This is determined by their Fitbit, so objectively determined. But the fast metabolizers had no difference in sleep. So again, there's heterogeneity, there's different propensities. But when people say, yeah, I can have a cappuccino and go right to bed, go right to sleep, they're probably fast metabolizers and they're probably telling the truth. And so, yeah.
It seems to me there's three states, because you can have a double hit, a mixed, heterozygous, it's called, I think.
Yeah.
Or you can have no hit on this caffeine detoxification gene. And so there's kind of three levels. I had myself genetically tested, and among the things that they spit out is like, what's your caffeine tolerance? And mine's intermediate, and that kind of that squares with how I react to coffee.
Interesting.
But you can actually get this done. You can actually find out. You can find out subjectively, know yourself, but you can also actually pinpoint what genetic type you are these days.
Yes, and there are several genes that can contribute. There are a couple of variants that are especially important.
Mm-hmm.
So we, for example, have applied what's called a polygenic score.
Okay.
But as you say, divided it into tertiles, so described as low, intermediate, and fast metabolizers, or slow, intermediate, and fast.
So these are commercially available. They're not too expensive. 23andMe, when it was extant, used to deliver that information, but I think there are other ways you can find out. So if you want to, you can find out what your caffeine tolerance is likely to be. All right. Well, this has been a great, far-reaching discussion, and I'm really pleased to see that American Heart Association has tackled what kind of a popular issue, because you've done a deep dive on the subject of, is coffee good, coffee bad, and I think that's a subject of great public interest. And so kudos to you for stepping out of the stereotype and undertaking an objective analysis of, what the scientific trials are saying. And, keep it up. Maybe more trials are underway and we'll get even more nuanced information on what caffeine and coffee, tea are good for, and, who should refrain.
Thanks very much for having me.
It's my great pleasure. Where can people find out more about what AHA has to say about coffee? Is there a website?
So yes, the American Heart Association has a website. The scientific statement is there. It's published in the journal Circulation, so available there as well.
All right, thanks very much for joining us. All the best to you, Dr. Gregory Marcus, Chair of the Scientific Statement Writing Group of the American Heart Association. Appreciate your time.
Thanks so much.
Thanks for joining us. I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast. I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything intelligent medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations. You're listening to Intelligent Medicine, a resource to help you take control of your health. We offer a balanced, objective analysis of all your health, wellness, and aging options, both conventional and alternative. Now you can take your engagement to the next level by joining FullScript. FullScript is my online dispensing platform that only offers curated, professional-grade supplement brands that I know and trust. Never counterfeit or expired, always stored and shipped correctly. Just go to drhoffmanstore.com for more information and to start your free FullScript account. Buying through FullScript offers fast, free shipping, optional refill reminders, a mobile-friendly site. It's safe, secure, and HIPAA compliant and offers world-class support. Just go to drhoffmanstore.com. You'll get access to the supplements and features you need to help you achieve your wellness goals, including my custom targeted protocols that combine the products I recommend to address specific needs, heart health, immune support, and much more. It's all at drhoffmanstore.com. drhoffmanstore.com.